Welcome to the Buckingham Center for Facial Plastic Surgery video tutorial. Today we're going to talk about brow lifting and upper eyelid blepharoplasty. So basically the upper 1/3 of the face. And that contrasts to the lower 2/3 of the face, which again we break up into thirds. So the middle third, which is the lower eyelid and cheek, and the lower third, which is the jawline or jowling and neck. So today we're going to focus here on the upper eyelid and forehead. And those go together because the forehead ages and leads to changes in the appearance of the upper eyelid. So when someone comes in and has concerns about the tired appearance of the upper eyelid, we really are looking at how the forehead, the brow, the upper eyelid, how all of those structures correlate with each other to determine how the aging process has affected those. So there's also differences between men and women in the way the brow looks. Men inherently have a little lower brow, and it also is a little flatter, so it basically stays right at or just below the orbital rim, which is this bony reflection you can feel as the forehead comes down and turns the corner to go back into the orbit. Women, the eyebrow aesthetically needs to be a little bit higher, and it has a little bit different configuration where the medial 2/3, or the club, which is what we start with here, progresses to a peak at the lateral third and then comes down. So it should be a little bit higher above the orbital rim and have a little bit of a nice arch to the brow. And those are the basic characteristics of the brow position in both men and women. And there's variations. People with oval faces look better with a little different brow configuration than people with more elongated faces. So we sometimes will tweak things based upon that. But that kind of is an individual discussion that we'd have to look at different faces to determine. So those are kind of the areas and how things age. So as you can see, as the brow comes down, it'll also accumulate skin in the upper eyelid. And you can do this on yourself. You can look in the mirror and raise your brow up, and you'll see how that cleans up the appearance of the upper eyelid. Or you can push the brow down, and you can see how that causes the skin to accumulate in the upper eyelid. So these two procedures go together as far as elevating the forehead and the brow and potentially removing skin from the upper lid. So forehead lifting or brow lifting is a very useful procedure for rejuvenating the forehead-brow upper eyelid complex, but certainly not everybody needs their brow and their forehead done. Many people only need to have the upper eyelid blepharoplasty done. And I would say that amongst surgical lifting procedures, the brow lift is probably the one that gets performed, especially in inexperienced hands, too often or overdone. So you see people who have this very surprised look. And that happens because, A, they didn't need their brow done, or alternatively, the brow gets lifted too high, or the medial club of the brow gets lifted too high. And so when you're doing a brow lift, you have a lot more room for tolerance to lift the lateral part of the brow than the medial part before you start making somebody look surprised. When you look surprised, you elevate the whole brow. It's a very startled expression. That's certainly something we don't want to do surgically. So what we need to do when somebody comes in is first we look and see, where the brow position is. And we'll just kind of talk about women for the moment here. So what we're looking is to see whether the brow sits at least or just above the orbital rim. If it does, then we're thinking to ourselves, okay, this person can probably get away with just doing an upper eyelid procedure. Or if it sits too low, then we're thinking about perhaps doing a brow procedure. Now, there's one more piece that goes into the brow and how it appears, and that's the brow fat pad. So in youth, and I challenge you to pick up, the latest Vogue or any other magazine that has stars in it, and see what their brow position is. And you'll see variable height in brow position, and all of it looks youthful. But in order to have a youthful brow, you really need to have this nice, full brow fat pad. And I truly believe that the appearance of the brow and how it relates as far as appearing low or adequate or youthful not only is involved with descent of the brow, but also what I refer to as ascent of the orbital rim, meaning that as you lose the brow fat pad, the orbital rim tends to at least appear as it's coming up, and so the brow itself, as it relates to that, goes down. So there's a lot of people that come in where I think their absolute brow position is fine, but they have a very hollow orbital rim, and so it's just not broad, it's very harsh, looks kind of like a cadaver. And so in a lot of people we can just do the addition of fat or fillers to that area to rejuvenate the brow fat pad, and that'll be enough for that area, and then we can just focus on doing the upper eyelid blepharoplasty. So let's talk a little bit about how we do that, because there's different ways to deal with doing a forehead lift. The blepharoplasty, there's somewhat variability in dealing with that too, but it's mostly in how you handle the fat pads. So the brow lift, we typically, in women, will do endoscopically. Now, how does that differ? What is an endoscopic brow lift as compared to other techniques? So to kind of lump them, there's open brow techniques, and then there's an endoscopic brow technique. An open brow technique means that you make an open incision. So either a coronal incision, meaning that you start in front of one ear, go all the way across within the hair. That's for people who have very low hairlines. It is an open technique. Or what we call a trichophytic incision, which means we come right in at the junction of the hair and the forehead. That would be for somebody who would have a very high forehead, so you're looking to perhaps shorten the forehead. Or in men, a mid-forehead brow lift, and we just utilize one of the forehead wrinkles to go in and elevate and remove skin from that area. So typically in women, we're doing an endoscopic brow lift. Most women have a low enough forehead that they can tolerate that. On a very rare occasion, we may do a combined procedure where we do an endoscopic brow lift, but we may also make a trichophytic incision and remove a little bit of that skin in the forehead to compensate for that really high forehead. But the advantage of the endoscopic brow lift is that instead of having one big open incision where you have a lot higher risk of nerve injury and numbness, hair loss, visible scar, and also a little bit more recovery, with the endoscopic techniques, there's a separated incision. So a very small incision in the midline, all of which are in the hair. A second incision in this, what we call the paramedian incision, which is about the mid-brow. In men, it's a little more medial because we're trying to do kind of a more generalized brow lift. And in women, it's a little bit more lateral because we're trying to generate that suspension point that happens in that incision at that peak that we're talked about between the medial two-thirds and the lateral third. And then there's also a temporal incision where we can get the temporal brow up, and actually we'll extend it down, release the upper cheek, and get a little bit of an upper cheek lift from that too. So through those endoscopic incisions, we use special curved instruments that allow us to go in, release all the attachments to the brow, then elevate that to the new position and secure it using a suture. And then as everything heals, the skin and everything will reattach to the bone in that new, more elevated position, which will give the brow a youthful appearance. And then in a lot of people that are having autologous fat or other things done for other reasons, we'll also add a little volume to that brow. And so that really rejuvenates that brow, the combination of the endoscopic technique for the brow lifting, as well as adding that fat and fullness to the brow fat pad, that will rejuvenate that. Now in men, oftentimes their brows are much heavier, their foreheads are much higher, and they give us these nice horizontal lines across their forehead. And so not that we don't do endoscopic brow lifts in men, but oftentimes in men it just presents itself that we'll use this forehead wrinkle. And so basically we'll go right through that, elevate a cutaneous skin flap, which means just underneath the skin and into the fatty layer, and then elevate that, and that'll be the brow lift in men. And not to say, like I said, we don't do endoscopic techniques, but about half the time we'll do a what we call a mid-forehead lift. And there's examples of both these, both endoscopic and mid-forehead brow lifts in on our website for men. So once the brow is elevated, then we address the upper eyelid if the brow needs to be elevated. And if not, then we can just either do with the upper eyelid blepharoplasty alone, or perhaps a fat transfer in an upper eyelid blepharoplasty. Blepharo just means eyelid. Plasty, of course, means to mold. And what that means is that we're basically removing usually redundant skin and occasionally redundant fat from the eyelid. We're very careful when we do upper eyelid blepharoplasties to leave the eyelid natural. And so I don't want to take somebody who has a natural skin fold, make an incision that's too high, remove all the fat from the eyelid, and then sculpt the upper eyelid so that it basically leaves you with a hollow upper eyelid that doesn't look natural. So we're very big about utilizing the natural eyelid crease so that we're not elevating that in people, preserving fat in the upper eyelid, unless you have a very fatty eyelid, and we just don't think you're going to get a result from doing that. And then basically go in, make the incision, remove the skin from that area, typically only remove a small fat from the medial eyelid, unless again you have a fatty eyelid, which then will go after some of that medial fat. And once again, you can look on the website. There's lots of before and after pictures of blepharoplasties, and you'll see people, and it typically says in the description, this person had fat in the medial or middle compartment, and we took that out, or we did whatever. And you can look and see from the before photos, you'll see lots of different configurations. People who have very heavy eyelids, people who have very what we call deep sulcuses, that basically means they don't have any fat in their upper eyelids. And you can see the different types of results, but I can promise you that as you look at those results, you'll see that the before photo very much resembles the after photo, and that we're very cautious not to take somebody who's got one eyelid configuration and turn it into a different eyelid configuration after that. So that really sums up how we would rejuvenate the upper third of the face as it relates to brow lifting and upper eyelid blepharoplasty. I hope that's been an educational talk for you, and that it brings some more value to your understanding of this procedure.